Victoria came all the way from Los Angeles, California for Dr. Vitolo's unique procedure.
I want those boobs and I'm going to feel better when I have the breasts. And other people there, Los Angeles is just like that. Everybody has something done to them, something done. It's a city where, you know, everybody's really vain.
But it was more than vanity that led Victoria to see Dr. Vitolo. For her, it was about confidence in the surgeon.
This happens to be a photograph of a patient of mine that's had a breast enlargement. Here she is as a 34A, and here she is as a 34C. You can see that we've made her breasts larger and that they look very natural. They bounce, they jiggle, they do everything a real breast is supposed to do. And you can see that there's basically no scar on the breast.
That's like one of the major things that women are concerned about, having hard breasts that look fake, you know, before you've even touched them. You can see from a mile away. And in Dr. Vitolo's case, all the pictures I've seen and people I've seen, they really looked good.
After the consultation, Dr. Vitolo does a visual examination of Victoria to determine what size implant is most appropriate.
You're about a 34B, maybe a real small C. Okay, and from the size of your body and from what we've discussed before, I think you'd be good as a large C to a small D.
First I was like, oh, I want a double D, and then I'm thinking, no, I won't go double D. I'll go a D. And then I'm thinking, I'm not going to be able to wear my tops. What am I going to buy? Blah, blah, blah. Now it's like the day before the surgery. I'm like, all right, let's just come back to earth, Victoria. I think I'll just take that C, please, the full C.
That's very interesting. It's been 6 weeks since Victoria had her surgery, and she looks great. Victoria, welcome. Now, there are a lot of doctors in Beverly Hills, California, and in Southern California. Why did you choose to come to New York to work with Dr. Vitolo?
Two reasons. Dr. Vitolo's reputation and also his procedure that only he does through the belly button and that there's no visible scars. That was a very important factor to me.
Now, Dr. Vitolo, she just described a little bit about your procedure. Why does it produce such a good result?
Well, there's such little trauma to the body with this procedure because there's very little cutting or burning of tissue and practically no bleeding, that the body heals so well that the results are very soft and natural. And plus, there's really no visible scar in proximity to the breast itself, and it enables people to keep the procedure secret if they wish.
Now, Victoria, how did you know what you wanted before the surgery? How did you know what type of breasts you wanted?
It's always been a thought in my head that I wanted larger breasts, but there was nothing like this procedure that I knew about before, and I didn't want to just go and get it the kind where you have all the scars under your arm or under your breast, and I've helped my girlfriends, you know, after their surgery that they had those kind, and it was, I mean, they were like in pain and they couldn't get out of bed for 2 weeks, and it just sort of turned me off.
So did you have any pain during the procedure?
No.
Not at all?
It's the most incredible thing. It was a snap.
Dr. Vitolo, how do you know what type of a silhouette to choose when you do the surgery on these women?
Well, I usually work with the patients, going with their body, their body contour, their height and their weight, and really their own desires. But one of the things that I do very frequently is I'll ask the patient to bring me a photograph of a nude breast from Playboy or one of those magazines, this way we're on the same page. I know what shape breast they like, what size breast they like. And, you know, it doesn't make any difference what size bra a patient wears. It's what the breast looks like.
That's interesting because a lot of people think it's size, so I think...
It's how it looks. That's what that's what plastic surgery is all about, how the breast looks.
Very interesting. Victoria, tell us a little bit about your recovery.
What recovery? No.
Really?
It was really quick.
You know, that's kind of interesting. What recovery? It was like no big deal, huh?
It's like nothing I've ever been through. As I said, that I'd helped my girlfriends before, and they had to rest for 2 weeks. I had the surgery on a Friday afternoon, and I went out to dinner on Sunday night.
Wow. Now,
and back up at work on Monday.
You mentioned your friends. What about their opinions of you? I mean, how do they feel?
Oh, they're all like, if I only knew. And I said, well, it was worth waiting for.
And how long would you say it took you to heal in general?
Well, there was I didn't have any swelling or bruising, so it was just the little incision on my belly button, and that was about a week.
Really?
Yeah.
Were you able to be active? Do
Oh, yes.
things?
I mean, I was back at work, workout, everything on Monday, and I had the surgery on a Friday.
It's kind of remarkable, isn't it?
It really is.
Oh.
Thank you for coming, Victoria. Appreciate your trip.
Hello and welcome to Doc Shop's Practice Profile. I'm Angelique Frame. Right now we're featuring board-certified plastic surgeon Dr. Robert Vitolo with offices throughout New York and New Jersey. Dr. Vitolo is known across the country for no visible scar transumbilical breast augmentation, no visible scar endoscopic facelifts, rhinoplasties, liposculpture, and so much more. His website, drvitolo.com, is packed with information you can use to decide which surgery is best for you. There are also videos about each procedure, before and after photos, and you can try out a virtual makeover. For more information or to find the office nearest you, please call the number on your screen or visit drvitolo.com. That's our practice profile on Dr. Robert Vitolo. I'm Doc Shop's Angelique Frame, connecting you with trusted doctors.